Hello, welcome. Thanks for joining us on Senior Connections. This is our monthly look at all kinds of topics that deal with older adults, their cares and concerns, and the people who care for them. It's brought to you by Senior Resources, which is your local area agency on aging. We serve Muskegon, Oceana, and Ottawa counties. We've been doing that since the very early 70s, and we're happy to try to bring you information of what could be sometimes a very confusing array of services and organizations that serve older adults. So we talk about things ranging from Medicare assistance to connecting to services and everything in between. And we hope that you'll find this information helpful. It is May. This is Older Americans Month, a month when we honor and recognize our older adults for all that they do, for everything that they have accomplished. The theme is engage at every age. And boy, we sure do see an awful lot of older adults doing that. And we certainly see that at Senior Resources, along with our other partners located in Tanglewood Park. So today, I'm very excited to have, for the first time, my very wonderful coworker, Andrea Douglas. She works with me at Senior Resources, and she supervises our Options Counseling Department, which truly is the gateway to services at Senior Resources, and quite honestly, for most older adults in our community. Welcome, Andrea. Can't believe it's your first time.
Thanks for having me. I'm excited to be here and
good.
Talk about our program.
Well, as I've said, and anytime I do speaking engagements, your department is the most, in my mind, the most important department at Senior Resources, because it really, truly is where we start. But before we talk a little bit more about that, why don't you tell us a little bit about you and your background? We were saying on the way over, you've come to Senior Resources in a different way. Well, we all come in different paths, but tell us a little bit about you.
So I've been at Senior Resources now about 6.5 years.
And you've never been on this show. It's a shame.
Never been on the show. I actually started at 211 when it was still part of Senior Resources, and then took some time off when I had my children, and then came back because it's such a wonderful agency and the mission is so wonderful. I came back when the Options Department was really getting started, when Options Counseling was really starting off. It used to be that when someone would call in looking for services, we could talk about our services and maybe put them on a wait list. And then we saw a need. Senior Resources really saw a need to change that. We want to see what all a person might be eligible for, what all help we can give right at the beginning, get them into the right program, whether it's ours or not, and that's really how Options Counseling started off. And so that's when I came back and been doing it ever since, and now the supervisor for it. It's a great program. It really, like you said, is a gateway to get people in.
So coming from 211, I imagine that gave you some really great skills dealing on the phone, although, as we'll find out, Options isn't just about phone calls.
Right.
But you were very broad in the 211 services. Certainly older adults is a major focal point. That's why we were involved in starting 211.
Absolutely.
But how big of a transition was that? Because we promote 211 on this show every month, always our last thing we say.
And 211 is actually we still through grant funding, still contract with 211 to do our enhanced senior INR, or information and referral. Mm-hmm. So we get a lot of referrals from 211, and we make a lot of referrals to them. So it wasn't a huge transition, just really kind of narrowing the focus in more on long-term care options is the biggest part of the options counselor's jobs.
Okay. Well, let's talk about those options counselors. It wasn't always called options counseling either, as I remember. I haven't been here as long as you, but we used to just refer to it as the intake. Which is such a dry word.
It is, because it's really, an intake has, and they do intake. It is part of the process, but Options is more about starting with talking about all options. So when someone calls and talks to an options counselor, they're not going to just talk about Senior Resources programs. We're going to talk about all different long-term care options that are available out in the community. And if one of Senior Resources programs seems the most appropriate, then they switch modes more into an intake mode. But it's certainly not how they start out. They will go into that mode if they need to get them into the right program at Senior Resources, and that's where the intake piece comes in. But it's definitely not just an intake process anymore. It's an options counseling.
So what kind of qualifications or training do the options counselors need? What kind of qualifications do they need to come there, and what kind of training do they get once they're there?
So all of our options counselors, there is no specific degree or anything that a person has to have, and we're actually really blessed to not have that, because we have options counselors from all different areas, and it's been made our department more well-rounded. So we have an options counselor that came to us from the hospice field. We have an options counselor that came to us with over 40 years of experience in long-term care, such as in a nursing home. One that came to us through VA, one that used to work in in-home health care. So we get that nice broad range of knowledge that really makes them able to talk to each other, get more information from each other, and be able to give really good information out to people when they call. So there's no specific degree or anything that they have to have, but when they get there, because options counseling is not a widely used job, most people don't exactly know what it is. So when they come, once they get there, we do a lot of training. We always say you're not going to feel real comfortable until you're about a year in, because there's so much to learn, because you really have to know so much about so much. So they get a lot of time working with other options counselors, shadowing, listening to calls, going with them on walk-ins, going to home visits. I really like them to tour different facilities that we might make referrals to, like an adult day center or an assisted living, a nursing home. Have them do different shadowing with other, it's like our supports coordinators for some of our other programs, so they can see how the process works from start to finish. Right. So when they get a call and they're talking about the programs, they can speak about them intelligently and answer questions, hopefully on the front end for the people that call in.
It really is. I've been at Senior Resources for 2.5 years. I finally I feel like I know pretty well what we do, but it definitely took a year or more. And a couple times I tried to listen to your options counselors. When Lisa Tyler listens, apparently it's a slow day because we get a lot. That's when they want a slow day, they call me in. But they are, our options counselors are at Senior Resources Monday through Friday from 8 a.m. to 4 p.m., right? That's when they'll take phone calls. You can reach us there. We'll give this number a few times. 231-733-3585. That's the number direct to the options counseling department. So why is that the starting point?
It really is just a great spot, because most people when they call, they know they need help, but they really don't know what it exactly is that they need or where to begin. Mm-hmm. So the options counselors can help them come up with a plan. So when you call and I know I need help for mom, or I know I need help for myself, I want to stay home. And that's the whole goal, is to stay independent and in the community as long as possible. That's what we're striving to help people to do. Of course, sometimes if that's not an option and they need something different, then we'll go that route if need be. But that's really our goal, is so when you call in and you don't know what you need, we're going to try to help listen to your story. That's always been our tagline, right. I think, is call us, tell us your story. Mm-hmm. Call us. Really it starts out with just tell me more. What's going on? Why are you calling? Finding out what services and sometimes they have no idea what services they just need. Know. I know I need help.
Going downhill.
Yeah, things aren't going, great, and we just think that we need more help. So let's talk about it. Let's try to identify what it is that's going on and what might be a help. So maybe, for example, a daughter calls about her mom, and she's living alone. She's maybe getting up there in age, and she's struggling a little bit, concerned that she's had a few falls. Mm-hmm. She lives alone. She's had a few falls, worried like what if something happens and she falls and can't get to a phone, and she doesn't get out, can't drive anymore. What can we do for like meals and making sure she's getting good meals? Some very simple things can help fix that. Some very simple services. One of the cheapest safety devices is a personal emergency response system. That is a button that they can wear either around their neck on a pendant or on their wrist. And if they have an emergency, they're not feeling good, something's off, they can push it and they can get help. And I know a lot of people are always concerned that it's, if I push that button, they're going to send someone lights and sirens. It doesn't have to be that way. You can actually work with the company who you go through to have a family member be a contact. So if you push the button, they can ask you what's going on, and you can tell them, and then they can call your contact for you. Mm-hmm. Or if it is an emergency or you don't respond, they can send emergency personnel. So really it's the jumping off point to really lead into, okay, you need help. Not exactly sure. Let's figure it out together. Let's talk it through, figure out what programs are out there, because there's so many. And like you said, it can be confusing. There's so many things, and what is the eligibility? And the options counselors are going to go through all that with you, and they're going to take the time to help come up with a plan. So once we've identified what the need is together, then let's start working on what steps we need to do to get there. So that's really why they're the gateway to not just our programs at Senior Resources, but really can help get the referrals to the right agencies.
The services
others.
for older adults in general. So just from everything you said there, this isn't usually going to be a 1-minute phone call. It's not like, I need the number 2, this isn't 411, it's not the information. And it's a little bit, and it's more detailed than 211. I mean, because they're going to do some of that, but a lot of times they're referring people to us for that.
Correct.
So some of the questions that people might be asked are financial. Can you talk to us a little bit about why? Just so people, I always think it's important, and I tell people all the time, there's reason for that. We're not just trying to fill out demographics. Yeah. Okay, we help this many people who are wealthy and this many who are.
We're not trying to be nosy. We really just, to make the right referral, a lot of programs have certain income and asset caps. I mean, a lot of, certain programs are Medicaid funded, and Medicaid has some really strict rules. Even some of the other funded programs through the Older American Money, those have prioritization categories. So we want to get you referred to the right program, make sure it's a good referral, because we would hate to go through all that. And like you said, it's not a 1-minute conversation. If someone calls in and you are just starting out, you can really expect that you're probably going to be on the phone for a good at least 15 minutes, but certainly depending on a person's situation, because everyone's is so unique, it could be much longer. It could be, I've been on the phone for an hour and a half before. And if it's tricky to be on the phone, or it's hard, then we can do it a different route, maybe through a visit. But like you said, the financial, it is an uncomfortable conversation. People don't want to share, and I don't blame them. Nobody wants to feel like they have to share everything to get something. But it is important, because we need to know. I don't want to go through all that with you, start something and not be able to finish it. I want to get you to the right place for what you need, and I want to make sure you're going to, I want to try to make sure that you're going to qualify and not, send you to somewhere and find out, oh, well, we went through all that and it didn't even work. So we do ask income information, financial information, to not only find the right program for you, but also there's prioritizations. So for certain wait lists for programs. So we want to make sure we get you on the right category. So sometimes people don't, if you don't want to share, you don't have to, but it does limit what we can refer you to, and it could make the wait time a little bit longer. So if you're able to share, it can hopefully get you into the right spot and get services moving faster for you.
So that's important information for people to know. We don't ask it just for whatever reason. Because as a reminder, and we've said this lots of times, our funding comes from a variety of sources, but primarily federal through the Older Americans Act, the Older Michiganians Act on the state level, and of course we've got a variety of different local funding, including in Muskegon a senior millage, and so that's been new options for people as well.
True.
What about the paperwork? The paperwork can be overwhelming. Do you help people with that?
Sure. So if they're being referred for a program where there is maybe like a Medicaid application, that's going to be necessary. Another big program we have is the My Choice Medicaid waiver. Medicaid's necessary. That's the funding source for those services. So, and it's a great program, but Medicaid can be tricky. So, and applications can be tricky. So we do help with that. We actually have a whole checklist put together of what items you will need to do a Medicaid application, to help walk you through it. We can help with the actual application itself, and if it, we have a Medicaid liaison for the program that helps with it. So we're going to help with the paperwork. We've helped with VA paperwork, and if we're not able or we don't know if it gets too complicated, we can try to get you to the right place. For like a married couple that has maybe some assets they want to protect, we can talk to you. I mean, we can't refer you to a specific person because we want to leave it open to choice, and but we can talk. It might be talk to a Medicaid estate planning attorney. That might be an option. So we're going to talk to you about that. If you call in and we get to that financial section, and it sounds like there's a lot going on, that maybe it might be over what we can do, we'll try to get you to the right place, though. But it is something we will help with the paperwork, definitely.
So there are a variety of things, including from the Medicaid waiver program on up to private pay programs. So really there's something, even if somebody, the easiest is probably when somebody meets those lower income levels because there's more programs available. But you can help people even if they don't qualify financially by referring them some other place.
Absolutely. If a person calls in and they have the ability, and that's the nice thing when a person, and I know it gets hard, but when a person has the ability to pay, it really opens doors because you have more choices then too. But we have a great activities-based companion care program that's private pay. We have an enhanced personal emergency response system that's private pay. Those are both great programs. And if you call in and you have the resources, and it's as our CEO will say, it's not just an agency for people with no money. We will help anybody. So if you call in and you have resources, you just don't know where to begin, we're still going to go through everything and talk about all the different programs and give you information on agencies that can do the care that you're looking for and help get you connected to them. So if you need that personal emergency response system or you need somebody to come in and help with homemaking, we will talk to you about different agencies that are in the area that can do that service, give you a price range of what it might cost, and just give you some more information about where to start.
Perfect. So when somebody calls, are you usually talking with the older adult himself or herself or with a family member or caregiver? Or, I'm sure it's both, but does there tend to be, my guess would be it would tend to be a caregiver or a family member, but I could be totally wrong.
We get, and it was interesting when you were talking about numbers earlier, we have, just in calls, we have 4 options counselors, and there's over 2,000 calls a month. So a lot of calls, and over average of 20 walk-ins a month about. We talk to so many different people. We talk to the person themselves a lot, and we try to, especially if you're your own person, we really want to know from you what you think you need. We're trying to be very person-centered about that. But we definitely get calls from family members calling for their loved one. We get calls from the hospital, doctor's office, nursing homes, adult protective services will make calls. We get referrals from almost anywhere you can think of. But we really try to always go back to, if we get a referral from an outside source, try to go back to the person they're referring and get the information straight from them, because they're their best advocate, they're their best historian. That's who we want to talk to. And
so unless they've got something like dementia or something.
Then we'll want to talk to whoever is, like an authorized representative or a power of attorney, or if there is none of that, then a family member or caregiver that's been working closely with them or knows them well. We're going to want to talk to somebody that can give us good information about what their needs are. But we take referrals from anywhere.
And you mentioned earlier, it isn't just about on the phone. So in what situation would you meet with somebody in person if that was necessary? It
really comes down to what, if they cannot do a phone conversation, a 45-minute call for somebody that maybe is hard of hearing, or is just really, because it is so complicated. If it's just not a good phone conversation, and they request it even, we can go out to the home and do a home visit. Sometimes we do family meetings where it's like, me and my sister are concerned about mom. We'd really like to get us all together at the same time, same place, so we all hear the same information at the same time. So we will do, home visits if needed. Most of it can be done on the phone. That's clearly the easiest way to do it and the fastest way, but if a home visit's needed, the options counselors are able to do that, and they can go to all 3 counties that we serve, Muskegon, Ottawa, and Oceana, and we have walk-ins. So our walk-ins are from 8 to 3:45. This is when they usually take the last one, and they will do the walk-ins right there. They will have, there's almost always an options counselor available. If you're able to call ahead and make an appointment, that's probably best, just so you can ensure we have a spot for you. Because like you said, Tanglewood is a very busy place. Yes. So we want to have a room. We want privacy to have that time. We want to be able to dedicate time to you and what you want to talk about. So it's great if you make an appointment, but we definitely will take walk-ins.
Perfect. So let's talk a little bit about this booklet that we've worked on together for a few years, our Options for Long-Term Care booklet.
Yes.
Tell us a little bit about that, because you've been involved, I do the printing of it, but you've been involved with it longer, and it's an award-winning booklet, we should say, from NAMPA, the National Association of Mature Publications, and there's another A there, North American Mature Publications
It's
Association,
long.
I think, which our Senior Perspectives newspaper is a member of, and we just won an award
Yes.
last year for this. And so let's tell everybody a little bit about what this is.
It's basically a very an outline of what we talk to people about. I mean, and certainly not everything's included in here, but it's a great starting point. It's available on our website, so people can go on there and download it. We have them available at Tanglewood Park at Senior Resources. It just really gives basic information: in-home care, out-of-home care, the cost of care, different programs like the Life Circles Pays, VA, Adult Home Help through DHS, our program. So it's got a little bit of everything in there, and it's a great starting point for somebody that just starting out. So we give them out a lot. And
Sometimes people just want to hold in their hands what you've said to them verbally, but it's kind of a reminder maybe of what they've
Or if they're, they don't need help quite yet, but they want to look down the road. We'll just look into the future. We know we're going to need something down the road. This is a great starting point to at least get some basic knowledge about what's out there.
I could see it could also be if I'm calling and I have a sibling who lives out of state or out of the area,
Yes.
that maybe it's sending them to
Yes,
so you're
they
not
can-
having to remember what all did Andrea tell me.
Yep, they can get on the website, download it super fast.
Yep, so that's always good. SeniorResourcesWMI.org is our website. So that is another great resource. In the last less than 10 minutes that we have, the time goes by fast. Let's talk about, I'm going to remind you one more time, our options counseling number is 733-3585. Can't remember that, you can always call 211, and I'll remind you of that again. But let's talk about another one of my favorite features at Senior Resources, and that's our medical loan closet. Yep. And we have a new resource coordinator, Jim Peterman, who couldn't be with us today. He's camera shy. But he joined us, when did he start?
Very end of February.
Okay, so he's only been with us for a couple of months, but talk to me a little bit about what his role is as resource coordinator and about our loan closet.
Absolutely. Jim is doing a fabulous job. He's really taken it on and making it his own. We have the loan closet that has durable medical equipment like walkers, wheelchairs, different assistive devices to try to help people that want to stay independent. It has incontinence supplies. Everything's donation based, so it's limited. People should really call to see what's available, and there's time frames and some restrictions, but it's a great resource for somebody that maybe just needs to get by until maybe something else starts, or it's they don't need it for very long. But what's great about Jim is that he's going to talk to you and find out because you actually we've had a lot of people that have insurance coverage that actually could pay for these items and they didn't know it, and they could be delivered right to their door. So great resource. He's going to talk to you about that and see if you qualify for that, because if you do, it would be so much better, new and fitted right to you. If you need a walker, a lot of it's talking to your doctor and getting the medical necessity forms, but if you need something and you're sometimes that's not an option, or if your Medicare or insurance already covered one, they might not be able to cover another one and within a certain time period. So it's a great resource to know about. It's out there. His number is 733-3570. Certainly call him to see what's available. He can talk you through it, and if we have it, and then please feel free to to make use of it. And we gladly will accept donations. We're always in need, and as a communications director that's putting it out there on social media, we're always in need of donations to keep it moving and to keep it going.
So these are free. There's not a
Currently,
fee for it right now.
There is no cost.
And something we evaluate all the time, that it's down the road that's needed for some popular items.
Sure.
But what do you what's mostly the high demand items? What do we get a lot? I'm going to know some of these answers from Facebook posts, but
Yeah, incontinence supplies, they're super expensive. So people, especially for the people that maybe have a little bit too much money to have full Medicaid, which would maybe cover that, but not enough money to actually buy them because they are so incredibly expensive. Those are the people that we're probably helping the most and that we're targeting the most. That's the biggest thing we get requests for.
Those were not, we don't want those back.
No.
Although partial unopened, or partial
Absolutely, if they're
unused
not used.
packages, yeah, we will definitely take. Right?
Absolutely, we would love any donations of, specifically a lot of people prefer the pull-up or the pull-on briefs as opposed to the tapes. But
right.
I mean, we will take anything, and when it comes down to it, if that's all we have available, if someone truly needs it, hopefully that will work for them.
And then wheelchairs I see a lot.
Wheelchairs.
Knee scooters are a big thing because
They
we
are.
sure seem to be blowing out our knees.
That,
all kinds of ages, it seems like.
We don't have a ton of those. I don't think we have currently any. Right now we might have one. That is something, any durable medical equipment that we do want back, there is a liability form that needs to be filled out. Specifically, knee scooters are almost always a short-term thing, and that would be something that we have a time limit on that we will request it back within a certain period of time.
And then there are some things we aren't going to take. And I think you'll understand most of them for hygiene reasons, but we don't take used commodes, right?
Yes. We just don't have the cleaning facilities to make sure that they're, absolutely clean. So we'd prefer, we cannot accept used commodes, but we would love to take any new or unused ones because it is a needed item out there, and we get a lot of requests for them. Something that I know we've asked for through like the Wish Foundation,
the Community Foundation.
So we were hoping that if we can purchase some to not loan, but to give out because we won't want them back.
That's right.
But absolutely, we'll take them as a donation if they're not used.
Right. So again, if you've got any of those items, you can call Jim. You can call our options counselors.
Absolutely.
They work hand in hand, really, together. And I hear him on the phone, and he is, you're getting a lot of phone calls.
Oh, yeah.
And you've just shared with some of our management team some of the statistics. Boy, we've got a lot of things going in and out. And we, of course, always accept cash donations, checks, credit cards as well for things. We just had give a little shout out to the Muskegon Surgery Center, which just recently did a collection of funds from their employees and called Jim and asked specifically what he wanted, so we got to get a lot of those common sizes that are called for those pull-on briefs, and then some other ointments and things like that. So what a gift that was. Thank you, Muskegon Surgery Center again. But anybody can do that, and if you follow our Facebook page, Senior Resources West Michigan Facebook page, every Friday we put up what the current needs are, but you don't have to do that. Here's the other things that we don't really take, the big items, because we're limited. We have a fairly small space that we share with maintenance for Tanglewood Park, and we do have a storage facility, but we're not in general able to take hospital beds and some bigger items.
Hoyers. We would happily, though, take the information. If you have one to donate or you need one, we get calls about them, so we'll put out the emails letting people know that it is out there, who to contact. So we'll do some email coordination. So if you have one you want to donate, we would happily take your information and give it out so that people can contact you and hopefully pick it up straight from you.
Right. So we really just try to give options, which is why it's such an appropriate thing for everything we do. So they're telling me that we're almost out of time. So we're going to one more time say, if you need help, need to have anything, call our options counselors at 733-3585. As always, if you can't remember that number, call 211. You can call that from a landline, from a cell phone. They will, if they hear you need something for older adults, they're going to do some figuring out what it is, and they'll refer you to our options counselors if need be. Andrea, thank you. This half hour went amazingly fast.
It did.
Tons of information. Older Americans Month this month. Remember options counseling when you need it. Thanks, and we'll see you next month.